Welcome to Uncaged, a show that celebrates thought leadership from today's top business leaders. The program provides a voice to amazing executives from around the globe who are shaping the world of business today and mapping the path to the commerce of tomorrow. Today, we're heading to the UK and speaking with Conor Burke. Hi, Conor. How are you?
I'm very well, Band. How are you doing?
I'm well. It's great to talk to you, Conor, and I'm sure you're going to be able to give us some timely advice on healthcare matters. Conor is the managing director at CPB Healthcare Consulting. He is an expert on healthcare and health tech solutions, and will really be digging into where technology and healthcare come together and some of the innovative solutions that are being developed and the pathways that are pointing forward for us in that area. But before we get to talking about CPB Healthcare and what you're doing there, Conor, tell us a little bit about yourself and your career today.
Sure, happy to, Ben. So, pretty long career, as you can tell, really, from my aged face, but about 30 years, pretty much in health and social care. I strangely, I did start my career with a degree in computer science, and then decided that that really sitting in a software house, which at the time was kind of the only option, where coding wasn't really for me, and so I went into the healthcare environment. I trained as a therapist, and then I went into management and within a number of hospitals, as well as health systems. My final proper job within the UK healthcare system in the NHS was as a chief executive of three what would be purchaser commissioner organisations, buyers, responsible for a population of about 750,000 people, a budget of about £1 billion. And our job was really to get best value out of purchasing services on behalf of our public, or in the case of the US, the insured, and really working out how do those best delivered against quality standards and in terms of economic cost. So that's kind of my background. I got liberated about 3 years ago, and since then I've kind of turned I guess gamekeeper turned poacher a little bit, and now what I do predominantly, as well as having a number of advisory and non-exec roles, is I support and give insights to emerging scale-ups and startups, particularly in the digital, med tech, health tech space, helping them to really understand how the NHS works, because people think it's one organisation rather than 500. Really think about the culture, the people, the behaviours, relationships, how to access it, how to navigate it, and how to really position solutions that are going to resonate with people's problems. So that's kind of what I do.
As an individual, Conor, that spent a significant amount of my life in the UK, I could attest to the complexities of the NHS and the need for your solutions and services. So, today, as we're living through this kind of complicated moment, what are you finding are the major challenges that companies are facing in that healthcare tech space?
Yeah, I tend to work with companies that have a product. It's a pretty good product, at least as far as they're concerned. They may have one or two customers, either internationally, globally, and see the NHS as a real opportunity, and given its size and the way it's funded. Or they may already be in the NHS with maybe two kind of trial sites, case uses, but they're really struggling to grow. They're really struggling to think through how do they scale and how do they make their product more available across the system. So, the first thing we do is kind of the first question I ask is, so what's the problem you're trying to solve for your customer? And that's sometimes a question they haven't asked themselves because they're so excited and emotional and invested in their own tech solutions that they kind of lost sight of actually let's focus on the problem and let's actually add value back to who's going to be the buyer. So what we tend to find is that, just having that initial conversation about really focusing on customers' needs, really delivering on the priorities of what a buyer wants is quite insightful for them. And then what that leads into is really, can we help you, or do you want to really understand how the buyers work and how they make decisions, and what you would need to do in order to better position your offer in a more compelling, in a more emotionally invested way, so that people feel more engaged in wanting to actually buy it. So those are the kind of things which sounds pretty simple to do, but when you've probably got, in the order of 500, 600, maybe even more than that, buyers across the system, all who have their own cultures and relationships and all want slightly different things. And clearly having quite a bespoke and quite a well-developed go-to-market plan and an ability to really target and segment how you're going to grow is what really makes the difference for a lot of these guys.
I've found that in technology that a lot of times we have innovation in clusters, right? That there are specific areas that seem to that the crowd chases. And I'd just be curious, when you are working with companies that are trying to build a relationship with, as you said, the different organizations that embody the NHS, are there specific topics that are high priority? I can only assume that anything right now related to COVID is probably the number one thing on everyone's mind, but perhaps I'm wrong about that.
Well, I think it's anything that's related to the impact of COVID rather than necessarily directly related to minimization of risk related to COVID. I mean, clearly 12 months ago, the market erupted globally as well as in the UK around, a sort of rush to buy a whole load of solutions, whether they be on the softer kind of side in terms of med tech, like ventilators, PPE, all of that kind of stuff, as well as, a big rush to suddenly nationally buy, video consultation type platforms for healthcare providers. So that was a big rush, clearly, to really try and minimize risk. And I'm sure lots of mistakes happened in the buying of that. And we've kind of now got to think through what we do next with those. I think currently the issue is, as we start to emerge from COVID, in many ways, exiting COVID is a lot more challenging than entering it. It's quite simple to shut down and then layer on relatively simple access solutions. What is now complicated is everything that we're going to have to deal with in safely exiting. So yes, there's the immediate issue around how do we control infection and all of the tech solutions surrounding that, as well as all of the physical solutions around social distancing, reducing hospital capacity, staff welfare. But actually, I'm sure, as in many other countries, the UK at the moment now has an enormous backlog created in terms of people that should have been seen over the last 18 months that clearly haven't been seen. So there's all of that in terms of understanding what is the risk related to what could be up to 10 million people requiring some sort of intervention. And, what is the priority setting? So data will be key to that in really understanding somebody's relative morbidity compared to somebody else's risk, and trying to therefore prioritize them, because, it's going to take 5 to 10 years to effectively get back to the position we were in 18 months ago, would be my guess. So there's that sort of stuff. There's the ongoing issue.
That's incredible that it's going to be. I mean, it probably shouldn't surprise me that certainly a vast majority of people most likely delayed medical visits if it wasn't urgent, if it wasn't an emergency. And so certainly the process of being on any list for any major surgery must have been delayed. And I can only imagine how complex it is to essentially get those lists going again, those processes going again. I'm particularly interested in that video health area. I feel like it offers so much promise on those kind of day-to-day visits. But I don't know if it's being fully embraced. Certainly, what we're seeing in the US right now is more legislation coming in place now, where medical boards are supporting the technology, but they seem to be limiting it. So if you are a doctor in New York and you want to operate this way, you can see patients in New York, but you can't see a patient in, let's say, Miami, Florida, right? So I'm curious to see how it's evolving for you.
Yeah, I mean, it's the market was starting to emerge pre-COVID, but it kind of accelerated, albeit there was a national solution that was pretty much offered to everybody in the NHS for free, particularly on the primary care side of things. So that has been adopted, but I think we're only at the beginning of that journey. And what clinicians are reporting is that actually it's added more pressure and workload into the system. So along with the people now that they could see again face to face, that they would see in a typical morning, up to about 40, patients that a typical general practitioner would see on their list. They also now have an extra burden of seeing people remotely through either text consultations or through video consultations. So actually their workload has increased by about 25% because we've opened new channels. And what we haven't done is, got productivity right on this. What I'm seeing is actually quite a lot now of new technologies coming through, like AI and machine learning, that are actually starting to do triage and symptom checking, so that if you, Bant, were at home not feeling well, you could put in your symptoms and go through a robot, and that would actually start to determine your pathway of care. Do you actually need to see a GP? Could you go and see a nurse? Could you go and see a physiotherapist? Do you actually, just want to go straight and have your bloods taken? So that actually is starting to demonstrate quite a lot of value in a better productive journey for both the patient, but also less demand for the clinicians. And I can only see those sorts of technologies increasingly exponentially over the next few years as the data becomes cleaner and better, and as the technology and the coding becomes much more reliable and much more effective.
So with a system like the NHS, it appears that what I have taken away and learned from you is that there's not one decision maker here, that it appears that there are multiple bodies that play a role in the procurement of solutions. So, I mean, how do tech entrepreneurs think about that? And is there a lot of difference between those different parts of the NHS on how they operate with innovation?
Yes, there's quite a bit of difference. I mean, the actual settings are no different to anywhere else in the world. So you've got, your kind of front door, which is your general practitioner sitting in the community. Then you've got your hospitals. And then, effectively, you'll have a periphery of other types of community services. All of them are structured and incentivized and remunerated and reimbursed in slightly different ways. So that in itself is quite complicated. And then sitting, I would say, around them is people like me who used to try and commission and procure services for all of those suppliers and from them in order to provide the most effective solution and integrate care in the most reasonable way for patients, users, and insured. So it is kind of complicated because within that, it's not one single decision maker. And even if I am this decision maker, your solution still needs to be adopted in order for you to demonstrate value. So, there are places where somebody like me might buy something, but then actually the hospital chooses not to actually implement it and drive it forward. So it's going to be really important for, any sort of provider to really understand how all of that works. What a lot of providers do is, they'll offer something initially for a relatively low cost or on a trial basis and demonstrate the value and run some sort of study to be able to, show that it's cost effective, but also provides, quality improvement. And that's great and that's good. But, the NHS has cottoned onto that and, it's very able to see through there is no such thing as a free meal. And so it doesn't guarantee you success. So I think, the really critical thing to do is to really target who you're going after, to demonstrate the difference you're going to make, and then to start reaching out and building up some of those relationships with the key people, which isn't just about selling. It's about saying, actually, how can we really help form a better partnership and be with you?
And it sounds to me like it's a process that requires a true process. It will take some time. I've been talking to folks about how one builds relationships, and I think that in the absence of people meeting face to face in the real world, I think it's been a bit challenging to build deep relationships. I certainly think it's possible to operate efficiently from a day-to-day business perspective, right? But to build the types of relationships that ultimately I think what you're talking about is what would be needed here, really. People that would understand a product or a service or a technology, would go through the testing processes and the trial processes and then implementation and then scaling. I mean, that is something that just doesn't happen overnight, correct?
Yeah, no, absolutely. Like I say, by the time they come to me, they've got the product, they've tested it, they know it works, but they're really struggling to build the relationships, and that's kind of where I help. And then what I do is I have a couple of colleagues that work with me who are more effective, at doing the kind of selling stuff. So they've got a well-established network as former recruiters who have helped people in their careers find jobs. And effectively what they do is leverage those relationships. So around a particular product or a particular segment in the market where they know they already have a trusted person that they can go to and almost broker that sort of deal. So that's the other unique bit is that it's not just advisory. It's not just you get a plan. Actually, then we help you actually take that plan through to success and help you to move it forward. It depends on the nature of the product in terms of how quickly. So we work with a couple of companies at the moment who we've been working with a year and probably one or two sales, but equally we've been working with quite a transactional product, and we've seen 20 to 30 sales in a relatively short period of time over the last 2 to 3 months, and that's because the product really resonates with what the market reads right now. And so understanding that is really, really critical. And then being able to be very specific about who is going to be the buyer. So in a hospital, you've got multiple influencers and buyers. It's not just the chief exec or the director of finance. You've got somebody there with a problem, like a director of estates or buildings or facilities or a director of nursing, and really, really helping them to become the advocate for what you're selling is essentially what we try and do is say, what is it that you need? And then they'll have the conversation with the chief exec or the director of finance about why they need this solution. So that's kind of how it works. The market's just getting so busy at the moment in respect of investors. We've seen more investments in health tech, I think, in the first 6 months of 21 than we've seen in the whole of 2020. So globally, and it's just rocketing. So I think having that differentiated approach to how you engage rather than just the sexy solution and product is going to be what helps break through into what is a complex area.
Right. Yeah, no, I think that's a good point because certainly I think there's a lot of investment pouring into the space, but the ultimate winners are going to be the ones that follow an approach that really builds that usage and those relationships and those connections inside of the system. So Conor, I'm having a hard time believing that you're actually in England right now as I look at this beautiful sunny day behind you. I'll take your word for it.
Oh,
But
I'm
yeah,
on my
but
boat, so it is nice and sunny and calm.
oh, lovely, lovely. But I mean, let's talk a little bit about how you've been able to operate during this period with COVID. The health sector has been under tremendous stress just to deliver on the needs of the pandemic, and obviously operating a system around that must have been challenging. But what are your learnings about how to approach the system today during this pandemic?
Yeah, it's been a really interesting year. So at one level, there was a mad rush in terms of the market, and like I say, there was a kind of national command and control reaction to let's just do everything nationally and let's just almost be like an armed force in the way that we manage the response to what was a very risky situation. Um, and I think a lot of smaller niche companies kind of um, didn't really. I think some were lucky because they had a voice and they were able to access some of the national influences quite quickly, but others kind of got left behind in that space. What we found, we've been very very busy during the last year, thankfully, in terms of trying to help people have the conversations about the value that they bring to the market. So that's been good for us. But what we found is that there's probably 4 or 5 real critical things that people are focused on at the moment. There's workforce resilience, which is really top of the agenda within healthcare at the moment for obvious reasons. And I think that will continue over the next few years, particularly as the workforce starts to have choices about what they do next, whether they continue to work in healthcare, are they too jaded, are they burnt out, do they want something a bit less pressured. So I think retaining people will be really critical, but the productivity around back office services and solutions that help you onboard people, help you get the most out of people in terms of productivity, or health and well-being type solutions for staff within high pressure services are all kind of on trend at the moment, and are the market is looking for help in those sorts of places. I think we touched a little bit on the other kind of big growth area around remote consultation and remote monitoring. So the first bit of that was kind of the video consult piece, but that's just the tip of the iceberg in terms of, well, that's fine. You and me have a conversation, but what happens next? So, I think this whole piece around remote monitoring and sensors and having smart devices in your home, whether it's the big boys, whether it's Apple or Google or Amazon or whatever it might be, I think they're all kind of looking at this marketplace now and starting to venture into it in different ways. From a consumer type sell, not necessarily a public services type sell. But I think both those markets will start coming together quite a lot. There'll be stuff that will be supplied for highly vulnerable people in the public sector by public services, and possibly the more direct consumer B2C sell will be for those that, probably are less at risk like you and me, but want something. So I can see, a lot of tech now. There's a boat next to me that's full of smart tech. It runs off apps. Effectively, you haven't got any buttons. So I can see all of that happening in homes very, very quickly over the next 5 to 10 years. We're working with a couple of products at the moment that do kind of remote monitoring via televisions, and people not even knowing it's there, but being able to sense movement, being able to sense something that's different from the normal pattern, and being able to issue reminders and as a communication tool to engage socially so you don't feel isolated. So I
Well,
think those
I think
are big
that
ones.
that monitoring space is, we're just scratching the surface. I look at how my sons use their iWatches, and it's, I think, if I know I don't have a representative sample, but they, I would say, primarily use their iWatch for tracking health, tracking all the health monitoring capabilities of that device.
Sure.
And I think that's exactly what you're referring to, which is, if we think of that sensor technology is actually not new. I mean, that's a relatively old technology, but certainly I suppose it's probably been microed in some form or fashion, and now it's being able to be applied and categorized in terms of the data that it's collecting. But you're absolutely right. People will be using that. And I think the other trend that you highlighted, the wellness, the just broader kind of work wellness area, has been one that, thank God, it's a focus. I imagine that there's going to be a lot of people that will find that they talk about this being the great resignation or something like that, at least in the US, where people are changing their jobs and their lives, et cetera, because they want more balance. And the healthcare profession certainly has had a tremendous amount of stress over the last 18 months, on top of a job that's already stressful, right? so, so
Sure.
yeah.
Yeah. No, I think that's all right. And it's not about new technologies. I think, when you think about, I mean, I'm going to sound quite disparaging now, but the NHS is still using, to some degree, fax machines and pagers. So, you know, it, it's not about the sexy new technology. It's about equipping people with the basic infrastructure and technology that might be around for the last 10 years, but applying it in a systematic way to release benefits. And so that's why selling, the sexy new thing isn't always the best thing to do. It's more about, can we build, the foundation, and then plug in later on something that that we need or want. And critical to whether it's the wellness agenda or whether it's the kind of sensory agenda and monitoring is the data. So I think the data is going to be absolutely fundamental. I mean, the good thing about the NHS is we're data rich. What we haven't managed to do at the moment is mine all of that in a way that connects it all together. But we're moving very strongly in that direction. And we're seeing a lot of collaborations and partnerships emerge with life science companies, with pharma, with medical device type companies. And that's been accelerated through COVID, through things like vaccine generation, where it's been almost the exemplar of how industry can start partnering with public sector organizations to make a real difference to the public health of a country. And so I can only see again that genie is out of the bottle now. And leveraging data for both commercial benefit around product development, whether it's on the drug side or on the tech side, as well as what that will bring to better healthcare outcomes through better measurement and targeting, is going to be really, really critical. And it's the old adage, isn't it, that data is the new gold.
Yeah, I think you just mentioned something I think is quite interesting. I mean, the data area, certainly there's a wealth of that information, and how we analyze it and glean insight from it is going to be critical, and I'd say even more than insight, actions that can then be applied for people. But in the case of COVID, it has been quite fascinating, because we have evolved from a period where it seemed like it would take absolute ages for solutions to come to market, and almost in this wartime moment, we've seen just rapid innovation, just unbelievable pace. Now, of course, we've seen that be challenged by some factors that have come out where certain providers perhaps had not considered all of the issues, but the reality is that pace in general has been phenomenal. do you think that there's been some great learnings here that will now be applied in other areas? Or was this just because we just poured tremendous amounts of money, capital, time to solve a crisis, kind of a war moment? Does
I
that
think the money, capital, time helped, certainly. But I think it was just the suspension of the usual bureaucracy that probably was the biggest factor. I mean, I'm sure mistakes were made also in that, but let's imagine 80% of it was done correctly and success, which isn't unreasonable given the scale of what was facing us. So, I kind of think it was the war mentality, wasn't it, of opening up the bomb shelters and creating the ordnance factories and all of that type of philosophy, but applied to a pandemic. My sense is, the NHS was born out of World War II, and everything that came out of that. So I think there will have to be, and there already is, a number of reforms that are starting to move forward. And the opportunity to grasp those and move them forward now is probably really critical, because it builds on the goodwill about how people have worked together for a common purpose and actually shown it was possible. So there is a lot of belief in the system now that we can do this, whereas before I suspect there was some skepticism as well as some lack of motivation. My kind of slightly concern around that is people are quite jaded at the moment. They've obviously fought the war, and it looks like it's starting to, we're starting to emerge from it. But it almost feels like the bigger challenge now is going to be, how do we reform? How do we get ourselves fit for purpose for what could be coming next, as well as actually start to transform what are a lot of redundant and old legacy technologies. So that's why I think it probably needs to be a slower pace. I think we're talking about 5-10 years in this, but I think we are certainly on that journey, and I think there's lots of things happening in the UK that probably are leading the way, but I suspect it's a global kind of journey that we're all going to be moving forward on.
Yeah, absolutely. Well, listen, Conor, it's been amazing to have you on the show today. We've been speaking with Conor Burke. He's the managing director at CPB Healthcare Consulting. He is transforming the delivery and the future of healthcare. We've been talking about a lot of the healthcare matters, bringing technologies and innovation to the healthcare system, the process that you have to go through, the areas that seem to be getting a lot of focus right now, the future that is going to be very focused around utilizing the data that has been being gathered and then applying that with the use of technology in a much more effective way. Conor, it's been great hearing your perspective on all of this. If someone wanted to reach you, where would they find you?
I'm on LinkedIn, so I think that's probably the easiest way to find me, is just Conor, Conor Burke. Just put that in the search bar and I should pop up.
Wonderful. Well, listen, thank you so much, and look forward to talking to you again soon. And I hope it stays sunny in England.
I'm sure it won't, but thank you.
Cheers.